Dr. Zhitnitsky, lately denture cream has been in the news in a controversial way. There are reports out there that apparently denture cream, which in most cases is containing zinc, and while zinc is a good thing, apparently too much of it, and right at the gateway of the mouth is too much of it, and people get numbness in the muscles, the nerves, they get twinkling and in the extremities, and frankly, apparently, some cases out there where the damage is quite severe, mentally and physically. Now, what do you have to say about that?
Yeah, the jury is not out on the zinc, but definitely ingesting chemicals couldn't be good for you. And
why? Because even the glue without zinc, it must be glue, right?
Right. It's in your mouth. It's sitting underneath a bad-fitting denture. You're swallowing it. Mm-hmm. In fact, I think I read a study somewhere that women eat approximately 2 pounds of lipstick in their lifetime, which can't be good for them either.
No.
But this is something that can be fixed. This is something that can be fixed really painlessly, relatively easily. All you need is some good-fitting dentures. And if your jaw is so resorbed that the bottom one doesn't fit at all, we can place a couple of implants and have it very stable. In that case, you don't need any glue. Your life will greatly improve. You'll be able to eat all the food that you like. You won't have any soreness. A bad-fitting denture, when it rubs against your mucosa, because mucosa is very, very sensitive, causes a lot of pain.
What's a mucosa?
In some instances, mucosa is the gum area where the teeth are missing.
Okay.
It's a very thin membrane, and there are some instances where people have gotten oral cancer from bad-fitting dentures, where they actually needed surgery.
Well, that's not good.
And this is something that's very easy to fix. All you need is some good-fitting dentures.
So, basically what you're saying here, what you're advocating here is that we can make a denture, kind of like a hybrid, put 2, 3, whatever implants in it, which is a lot cheaper than a whole roundhouse of implants, and support the denture that way. By doing so, no more glue ever needed. And what about a person who has an implant-supported denture, let's just say, can that person bite into an apple and chew on a prime rib?
Oh, absolutely. What happens is that when you have regular dentures, your chewing efficiency is only about a third of what it used to be, and they're constantly loose. But if you put a couple of implants and you attach a denture to those implants, it's very stable, not only horizontally but vertically. So that's why people eat whatever they like.
Wow.
And in some instances, when if it's a top denture, the roof of your mouth can be opened up. And you have a lot of taste buds in the roof of your mouth, so you'll be able to taste your food better, you're better to chew better. It increases your quality of life tremendously.
Yeah, that right there would do it for me. Besides of thinking of having this chewing, I always have problems with those, things. I mean, I don't have dentures, but anything of this gluey stuff. Now, let me ask you. You said something, a good-fitting denture. There's the impression out there that, people, go to the dentist and they have a denture and it fits all right, and then a year, 2, 3, whatever, later it doesn't fit so well anymore, and they actually think that the denture has worn out like an old shoe. But apparently that's not really how it is. It's really that the person's gums, jaw bones basically have been shrinking. Is that right?
Absolutely. If jaws have no teeth in them, they shrink. And that's what happens. So, in the future, if you would like to get implants, it's a little harder if your jaws have shrunk versus if you had just your teeth taken out recently. That way you have more bone and you have more support for implants. But in any case, if you have dentures at least once a year, you're supposed to make special impressions and make them a little tighter so they fit nicely.
And that's because you are losing bones, not the dentures are wearing out.
Yes, jaws are shrinking.
So fix it once and for all with some implant-supported denture, and you're done with it. You can taste your food better, and it must be a huge confidence increase that, you, even let's just say a normal denture doesn't necessarily fall out that easy, but just that feeling when you're amongst, Thanksgiving dinner and there's all those people and you feel it a little loose. It must be an awful feeling.
Yes. And if I can add, an added benefit is when you place implants, your jaw bones don't shrink anymore.
So you don't get that caved in, dried out tomato look anymore?
Right,
15 years older than you really are?
Absolutely. Implants seem to maintain the level of your jawbone, so if you put a couple of implants in, your jaws don't shrink in those areas, which is a very good thing.
Well, all right, here you have it. So, regardless whether this controversy or this news about, zinc poisoning you and making you mentally and physically handicapped, damaging your nerves, because apparently that's what too much of it does, and makes sense that if you have that into your mouth, which is the gateway, that it could happen. But regardless whether that's true or not, regardless whether the people like Fixodent come up with a better cream where that isn't in it, which I'm sure they will, regardless of whether it's true or not, they will avoid it anyway. Either way, it looks like the benefit of never having to use a cream are just like, it's not only because of the potential poisoning. Just go and do it because you have basically again a more youthful life.